Coming to that refractive correction is
Yes.
where we talk about LASIK.
Yes.
LASIK.
Yeah.
So, for example, I am wearing a glass.
Hmm.
I want to get rid of this.
Yes.
LASIK is an option where we can correct the refraction.
Yeah.
Can you explain how that works?
Before we go on to LASIK, I just want to dwell on the refractive portion of the cataract surgery, and that is that the lens, the artificial lens that is implanted in the eye, can be monofocal lenses. That means with one focus. They can be toric lenses. Like earlier, the lenses that we used to implant within the eye had just a spherical correction. But if you wear your glasses, anybody who's wearing glasses can be having a spherical and a cylindrical power, right? So we didn't have lenses till a decade ago which could also correct your cylindrical power. So now you have toric lenses, and if a person needs a cylindrical power in glasses, the optometrist or the ophthalmologist will not even ask you. He will prescribe a sphere and a cylinder and you wear it. So similarly, now in cataract surgery, in the intraocular lenses, we do spherical lenses or toric lenses if required. Then there are the two other varieties of lenses which can correct the need for reading glasses post-operatively. I told you monofocal. So monofocal is a plastic lens, acrylic. It will not change its focus. So it will be fixed for a particular distance, usually for distance vision. And when you have to do computer work or you have to do reading work, you will need an addition of plus glasses. So like I told you that you have progressive lenses, you have now trifocal lenses. So these lenses can give you three focuses for distance, intermediate and near. There are some pitfalls, etc. for it, like you can get glare and halos in driving. So that depends on the profile of the patient. We can select, but we can use these trifocal lenses. And then there is a new variety which is called as EDOF lenses, extended depth of focus.
EDOF.
Yeah, EDOF lenses. So you have normally, whenever there is a lens, it comes to a point focus. In trifocal, there are three focuses. One focus, two focus, three focus. Brain has the plasticity to ignore the other two focuses when you are not concentrating at that distance. Supposing I'm looking at distance, so there is a blur for the intermediate focus and there is a blur for the distance focus.
Wow.
So the brain will ignore these two images and only look, and vice versa. If I'm reading, it will look at the focus here and ignore the other one. So in trifocal, there are simultaneously three focuses that are being formed and the brain ignores that. Now in an EDOF lens, you are extending the depth of focus. That means instead of one focus, you are extending it, and you will see well here also and you will see well here also. So they are typically nowadays giving you a seamless vision or a continuous range of vision for distance and intermediate, and some of the new EDOF lenses are now also giving you good reading vision. So your dependence on glasses post-operatively gets reduced significantly. Patient comes to us, eliminate glasses. We never promise eliminating glasses post-operatively. We just say it will reduce your dependence on glasses for all distance.
Follow Center for Sight and post your queries to get answers from the experts.